Good afternoon, and thank you for joining us for this special podcast. Hi, I'm Justin Elliott, Vice President of Government Affairs at the American Physical Therapy Association.
And I'm Kara Gaynor, APTA's Director of Regulatory Affairs.
Today we're going to talk a little bit about all the activity that's been happening over the last several weeks on Capitol Hill and with CMS. There's been a lot of changes, both legislation as well as new regulations, and of course breaking news last night on a new rule that impacts telehealth. But first, we want to start off by saying thank you to you, to the members who are out there on the front lines during this incredibly difficult time. We know this is a stressful time, and there's a lot of challenges and anxiety. And please know that APTA is doing all that we can to provide up-to-date information and resources to assist you. So first, let's talk a little bit about the big news of the day, and that is with telehealth. So let's first take a step back and look at the big picture, what's been going on with telehealth since the pandemic began back in early March. Now, there was a lot of news in the first couple weeks of March as it relates to telehealth. You saw the president issue a national declaration of emergency, and then we saw activation of what are known as 1135 waivers. This is a mechanism under federal law that gives the president the authority to waive certain regulations and restrictions during a declared emergency. And so there was a lot of work in early March to waive a lot of the restrictions as it relates to telehealth. Unfortunately, those did not impact physical therapy. And that is because under federal law, currently physical therapists are not legally authorized to be providing telehealth under Medicare, along with a number of other providers. And so what we saw early on in March really primarily impacted and provided flexibility for physicians and nurses. But what happened at the end of March was Congress passed a bill called the CARES Act. And one of the things that legislation did was provide additional legal authority to HHS to waive additional federal laws, specifically to include additional providers for telehealth. And we have been waiting very eagerly for HHS to make the announcement that they are going to expand the ability of other providers, new providers, to provide telehealth services for Medicare beneficiaries. And last night or yesterday afternoon, we had some big news from CMS. Kara, can you tell us a little bit about what we heard yesterday from CMS on this?
Sure. Thanks, Justin. So as many of you probably saw, CMS released a lot of new guidance to provide healthcare providers with regulatory relief and flexibility. And within that guidance, CMS did state that they are waiving the requirements of the Social Security Act, Section 1834, and the corresponding regulation, which specifies the type of practitioners that may bill for their services when furnished as Medicare telehealth services. And so the waiver of these requirements expands the types of healthcare professionals that can furnish distant site telehealth services to include all those that are eligible to bill Medicare for their professional services. So this waiver allows healthcare professionals who were previously ineligible to furnish and bill for Medicare telehealth services, including physical therapists, to receive payment for Medicare telehealth services. Now, I will note that we obviously are sure and positive that physical therapists in private practice are now among the healthcare professionals able to bill for telehealth services. And this is retroactive to March 1st, 2020. However, I will note that we are seeking clarification from CMS regarding whether physical therapist assistants may furnish telehealth under the supervision of the physical therapist. And there have been a lot of questions regarding whether institutional settings, including hospital outpatient departments, are eligible to bill for telehealth services furnished by physical therapists. And we are also seeking clarification from CMS regarding that question. So please stay tuned. We hope to have additional guidance from CMS ideally before this weekend, but it may not be until early next week. That said, CMS will have a national town hall on Tuesday, May 5th. And so we do plan to, again, ask these questions if CMS does not address them beforehand. So please stay tuned on that. It's a big win, but we recognize that additional advocacy may be needed depending on CMS's interpretation and guidance that they share. And so we will continue to advocate for the inclusion of all providers to furnish telehealth under Medicare. But Justin, do you want to maybe talk a little bit about our long-term strategy to achieve a permanent fix to the Medicare telehealth problem?
Yeah, and first I want to say thank you to all the members out there who throughout the last several weeks have been writing letters to CMS and doing a great deal of work in terms of regulatory advocacy to really push CMS. And also a huge shout out to Congresswoman Cindy Axne of Iowa, along with Congressman French Hill and Troy Balderson, who introduced legislation that basically would force HHS to make this change and really help put pressure on HHS to do so. And also, as Kara mentioned, this is the use of this waiver is only temporary. And so all of these waivers that the federal government has done over the last several weeks, those all go away when the national emergency is declared over. And so while we are thrilled with this latest development, we still need a long-term policy solution. We need to have a change in the federal statute to add physical therapists and physical therapist assistants as permanent authorized providers of telehealth under Medicare. Now, the good news is that even prior to the start of this pandemic, APTA, along with a number of other provider groups, American Occupational Therapy Association, American Speech Hearing Language Association, we're all supporting a bill called the Connect for Health Act. This is bipartisan legislation that was introduced in Congress that would provide a permanent policy fix. This would add physical therapists, occupational therapists, speech language, PTAs, OTAs, number of other providers as being authorized as being able to provide telehealth under Medicare to Medicare beneficiaries. And so we are continuing to look and advocate for a long-term policy solution. We are asking Congress to include and to pass the Connect for Health Act. And we hope and are that we will have an opportunity to see that become a reality. As Congress begins work on its next COVID relief package, this is one of our major priorities and recommendations that we're asking that Congress include in that package. And that is simply just add the Connect for Health Act into the COVID Phase 4 package. We need a permanent policy solution because we don't know where we're going to be 3 months from now, 6 months from now, a year from now. And right now, Medicare beneficiaries, what they want is some stability and being able to access the care that they need. And so that's why we need to make sure that this policy is made permanent.
And I would just also add, as a reminder, regardless of payer policy, remember that you need to check your State Practice Act to see if telehealth is within your scope of practice. And also, if you are practicing across state lines, you need to be licensed where the patient is located. So just remember that obviously payer policy is one element as to whether telehealth is going to be covered, but you also want to make sure that you're complying with all applicable state and any other federal laws that may apply, including licensure and scope of practice. And then I will also add that Medicare added 15 CPT codes to the list of services that can be furnished via telehealth. And so we did include that in a news story that we published yesterday. And so please do check that out if you haven't seen it already. It does give guidance on how to bill under Medicare for telehealth, the codes eligible, the modifiers required, and the place of service code, and then also outlines the technology requirements, documentation, and so forth.
So, switching gears a little bit, today's May 1st, and today is the start of a policy that was included in the CARES Act, which was passed and signed into law at the end of March. What will happen today for those folks who bill Medicare is they should start seeing a bump in payment. One of the things that the CARES Act did was it basically suspended a policy known as Medicare sequestration. Medicare sequestration is something that went into effect back in 2013. It was a policy designed to try to get control of deficit spending. And ever since 2013, we have seen in Medicare payments a 2% cut in terms of payment across Medicare. One of the things that Congress did is to suspend that 2% cut through the end of the year. And that takes effect today, Friday, May 1st, and will run through the end of the year. So folks should start beginning to see a small increase, 2%, in their Medicare payments. But one of the things, Kara, I wanted to ask you is that how will this impact Medicare Advantage plans? Because Medicare Advantage plans have a little bit more flexibility and ability to set their own rules. And so have you heard anything about how you anticipate with Medicare Advantage?
Yeah, thanks, Justin. So this is a question that we looked into recently. And after the sequestration was implemented, CMS did issue guidance that the 2% sequestration reduction does apply to Medicare Advantage payments beginning back in 2013. And this guidance document that CMS issued also discussed whether sequestration and how sequestration might affect a Medicare Advantage organization's payments to its contracted providers. And CMS noted that these payments are governed by the terms of the contract between the Medicare Advantage organization and the provider. So it depends on the contract that the provider has with the Medicare Advantage organization as to whether this sequestration elimination for the remainder of the year will or will not apply to the contract that the provider has with that specific MA plan. So you could look for language in your contract, for example, that might say something like, in the event that CMS changes its compensation to the plan as a result of an act of Congress or a CMS directive, the amount payable to the provider will automatically be adjusted in the amount specified by CMS, or something like that. So we would encourage all providers to review their contracts with MA plans closely to see if the MA plan may be required to actually remove sequestration as well or not.
Yeah. Well, you know, another way that healthcare providers are seeing a boost and assistance as a result of the CARES Act was a fund that was set up and that called the Public Health Service Emergency Fund. This was $100 billion that Congress set aside to go towards Medicare enrolled providers. And what we saw on April 10th, that a number of healthcare providers, again, who were Medicare enrolled into up to, I believe last year was the cutoff, saw direct deposits go into their accounts. And that amount of money was based on their Medicare billing in 2019. And we know that Medicare is getting, or HHS is getting ready to begin their next round of distributions. And so it's been a great assistance, and we're happy to see that assistance. But Kara, what are some of the questions that you've seen, or what have you heard in terms of HHS, in terms of what it means to be eligible for it, and what that money can be used for and cannot be used for?
Sure. So first, I'll start off with a simpler question that we've been getting because there are some providers who don't need the funds, or they've actually closed and need to return the funds. And so the guidance we've been sharing in relation to that question is how to return the funds, is that you need to actually go to the CARES Act Provider Relief Fund Payment Attestation Portal, and you must complete the attestation to indicate that you're rejecting the funds. And that payment portal will guide you through the attestation process to either accept or reject the funds. So that's in terms of rejection. That is the same portal that you would use to accept the funds. And we've been sharing guidance that we encourage everyone to closely read the accompanying terms and conditions associated with accepting this funding. There continues to be some questions related to the terms and conditions. And so we have reached out to HHS, as have other stakeholders, to try to get additional clarification. And they do continue to update their guidance. A common question or a common point of clarification that I would like to note here today is that you kind of have to think about so Justin mentioned the fund that started being distributed on April 10th. And so that beginning on April 10th and then subsequently for the couple of weeks thereafter, the initial $30 billion of the fund was essentially deposited directly into Medicare providers' accounts. And now we have the $20 billion fund that is under the umbrella of a total $50 billion general distribution. And so it's actually for this $20 billion fund that you need to actually apply for. And you have to enter a lot of information related to your revenues and costs, and HHS will review that information and then allocate, based on your 2018 net patient revenue, an amount. And the $20 billion, this second round of funding, should be based more, or it is trying to design, it's designed to try to help those Medicare providers who may not have a lot of Medicare patients in general, and in the first round of funding didn't get a lot. But in the second round, hopefully if they have, let's say, more commercial or Medicare Advantage or Medicaid, this second round of funding theoretically should help to supplement what might have been a lower than anticipated amount in the first round due to a low Medicare patient population. But so for this second round, you do have to go in and apply. And again, you do want to read those terms and conditions. And if you have questions, for example, if you did receive money in the first round, or then you should be eligible to apply for the second round of $20 billion. If you did not receive funding in the first round, but you are a Medicare provider and received reimbursement between October to December of 2019, I would suggest calling United Health Group, which HHS has contracted with to run the program. And their number, we can include the number in the chat or in the comment section, but UHG, United Health Group, can be reached at 866-569-3522. And if they're not able to help, we would suggest you email CMS, even though CMS is not administering it. It is an email address that CMS has said they will forward the emails on to the appropriate staff. And that CMS email address is covid-19@cms.hhs.gov. And then finally, you may wish to consider reaching out to your members of Congress to bring this to their attention and see if they are able to reach out to HHS on your behalf. So those are a few ways, if you should have received funding in the first round and didn't, those are kind of our steps that we would suggest you take. So I think I've tried to cover what you asked.
No, and it brings up another good point, because along with this fund that Congress set up, they also set up another program called the Paycheck Protection Program. And this was a couple $100 million that they set aside in the CARES Act that was passed back in March. They went back, a week ago and put in additional money for it. And the program rolled out towards the end of March. It had a couple hiccups, a couple bumps in the road in terms of its rollout. There was also, it's been in the news because so there were some companies that accepted money that probably shouldn't have. But for those who aren't aware of it, it is a program that is being administered by the Small Business Administration that will give loans with an interest rate of about 1%. They are capped at 4%, but most of them are at 1%. It's only for companies with 500 or less employees. And this money, that it can be utilized by small businesses to help with costs, that have been impacted as related to the current pandemic. And so it can be used to pay for medical leave, family leave, payment on interest for mortgage obligations for your business, as well as rent and utilities. And so I know APTA, we have a good deal of information on our website about this program. If you haven't checked out the program, do go to the Small Business Administration, SBA.gov, to learn more about it. Be sure to review the FAQ document they have that are specific to some of the information you're going to need to know to apply for this loan with the banks. And so we've heard a number of our members have applied for this. I know we are waiting for even more members to find out if they're going to receive this. But Kara, I don't know if you have anything to add on that, or anything you've heard lately from members on this program.
No, I haven't. I did actually hear from someone who had gotten the loan, so that was positive. But yeah, no, I don't have anything to add. It's been pretty quiet on the questions front. Yeah.
Switching gears, another good piece of news in that impacts PTAs, and one that we've been waiting for a long time, and that is the addition of both physical therapist assistants and occupational therapy assistants to the Tricare program. And this was a result of legislation that APTA and our friends at AOTA championed a couple years ago to force the Department of Defense to add PTAs and OTAs through legislation. And once the bill got passed, we had to wait as DOD had to go through their regulatory process. But now it's official. And Kara, tell us a little bit about the regs and some of the information that we've received just in the last couple of weeks on this.
Yeah, thanks. So the regulations went into effect on April 16th, 2020. And so for dates of service beginning then and forward, services furnished by PTAs and OTAs are reimbursable under Tricare. And shortly after the regulations went into effect, the Defense Health Agency updated the Tricare policy manual and indicated they outlined the scope of practice and qualification and supervision requirements for PTAs in Tricare Policy Manual, Chapter 11, Section 3.16. And it matches Medicare as they indicated that it would in the final rule, but they also said that they would require the CQ modifier to denote when services are furnished in whole or in part by the PTA, and then for the OTA, it is the CO modifier. So we do have that guidance in the Tricare Policy Manual that's been published, and so now, yes, claims can be submitted and they should be processed normally as Tricare had known that they would be requiring the CQ and CO modifiers. So the contractor should be prepared to process these claims correctly. But then we are now waiting on the Tricare contractors, Humana Military and Health Net Federal Services, which are the contractors for the East and West region, respectively, to update their policy manuals or their provider handbook to formally recognize PTAs and OTAs as Tricare authorized providers. And so that is the final step to this process. And as Justin mentioned, it's been a long, drawn out process. But the good thing is claims can be submitted. If claims are denied because the CQ or CO modifier is appended to the claim, Defense Health Agency has told us to tell providers that you should resubmit the claim because they should be processing normally. So just stay tuned for, if you are a Tricare provider, just stay tuned for any additional updates from your Tricare contractor. And then we had published an article outlining the Tricare policy manual and hyperlink to it. And we can put that link to the news story in the comments as well. So so big news, great news. We were thrilled, especially such a strange time to release the rule in the public health emergency, but they did, and it's now in effect.
Yeah, and again, thanks to all of our members, PTs and PTAs, who were advocating on this, both when the legislation was going through Congress, but also throughout the regulatory process. And, really appreciate the work of the PTA caucus on this and their support and advocacy work. And, really glad to see that this is finally implemented, because I know folks were eager to see this. We do have a question about on the Paycheck Protection Program. Is there a mandatory timeline for furloughed employees to return to employment if a company receives a Paycheck Protection loan? That's a great question. That's something we can look at. I'm not sure if that is set out in the statute, but we can certainly take a look at it. I think, one thing to also highlight is that there is another loan program called the Emergency Economic Injury disaster loans, also through SBA. That is also eligible for small businesses.
I will also mention, Justin, and we'll put the links in the comments, but we'll include the links to the FAQs and information for borrowers. But also, questions on the Paycheck Protection Program loans can be directed to the lender relations specialist in the local Small Business Administration field office, and so we'll include the link to that as well. But in the interim, we'll also go back and look to see if we can find an answer to that question. Yeah,
that's a great question. Great question. I did want to also point out for those students and young professionals, the CARES Act, and anyone who has a student loan, the CARES Act did provide some funding aimed at student loans as well as higher education. In particular, one thing it did is that it defers student loan payments, principal and interest, for 6 months through September 30th of 2020. In addition, it provides $14.25 billion to colleges and universities And of that, 6.28 will go towards assistance. That is money that universities and colleges can utilize to assist students. And that will be for expenses related to disruptions in their education due to the COVID outbreak, and can be used for things like course materials, technology, food, housing, healthcare, and childcare. Now, the Department of Education has already begun distributing this the $14.25 billion that is going directly from Department of Education to colleges and universities. Each college and university is going to get a different amount based on this formula that the Department of Education has put together. But if you have a federal student loan, and it should be noted that the loan relief that is through September 30th, that's only for federal loans. It does not apply to private loans. And in addition, there is a new tax credit that folks should be aware of for employers who want to help out employees who have student loans. This credit enables providers to make a payment benefit on a tax-free basis. And so under the provision, an employer can contribute up to $5,250 annually towards an employee's student loans. And that will be excluded from the employee's income for tax purposes. And so that applies to any student loan payments made by an employer after the date of enactment of the law, which is March 27th, and through January 1st, 2021. So we have this window of opportunity between March and 2021 for this tax credit that employers can use to provide assistance to their employees who have federal student loans. So be sure to check that out and talk to your employer about that to see if they may be interested on that as well. You know, Kara, I wanted to go back to telehealth because that's been such a big issue that not only APTA has been working on, but our state chapters and our sections. And what has been interesting to watch is, we're thrilled with the announcement yesterday by Medicare, but it's been interesting to watch at the state level a lot of state payers who have been way out in front of this, as well as state Medicaid programs, which have been aggressive in expanding their benefits to therapy services. And so would you see if you had any thoughts or any reflections or about what you've seen from the private payer or Medicaid side as it relates to telehealth?
Yeah, so you're right. Oh, it sounds like an echo. Do you hear the echo?
I don't hear an echo.
Okay, weird. So we've definitely seen states lead in this area, and commercial payers have taken the lead, as have governors. And so we've seen a lot of state level actions related to either non-federal payer coverage of telehealth, meaning primarily Medicaid, but also commercial payers. And, I think that where we're headed next, I certainly think that this public health emergency has changed the dynamic and scope of telehealth, and it likely will be changed forever. But I think that in terms of immediate next steps, I just wanted to take the opportunity to say that, a lot of the actions taken by states or commercial payers have a time limit. And a lot of those time limits or deadlines for these new telehealth coverage policies are coming up quickly. And so we will have available on our website templates for you to use, as well as for your patients to use, to advocate for continued telehealth coverage with the payers. Because obviously the public health emergency is anywhere from over, and we need to ensure that patients continue to have access to physical therapist services. And so we actually update on a weekly basis every Thursday. We update our telehealth webpage on apta.org/telehealth, and we list out the commercial payer telehealth coverage policies, the non-federal payer coverage policies, state actions permitting PTs and PTAs to provide telehealth. If you recall earlier, I talked about you need to make sure that telehealth is within your state practice act. And we have seen a lot of flexibility issued by the states to allow PTs and in some instances PTAs as well to furnish telehealth within their state. So do check those resources out because we do continue to update them. And obviously, we also have a federal payer telehealth coverage chart. And until yesterday, it indicated that Medicare was not covering telehealth when furnished by PTs. But obviously, we will update that. I do also want to note that we list Tricare and the two contractors on that site or on our chart of payers who are covering telehealth. And we are aware that Humana Military covers telehealth treatment, but does not cover an initial evaluation done by a PT or OT. And so recently, APTA sent a letter to Humana asking them to lift this restriction and allow telehealth coverage for initial evaluations. And so we're hopeful that with this latest move by Medicare to recognize physical therapists as authorized telehealth providers, which, as I'm sure you saw, Medicare is covering initial evaluations done by physical therapists. Hopefully that, in combination with the requests that we've been submitting over the last 6-8 weeks, will push it across the finish line. And not only will Humana Military cover initial eval via telehealth, but hopefully also Humana will change their policies as well.
Yeah. No, it's been interesting to watch telehealth. I think ever since this pandemic started back in early March, just the work that state Medicaid, private insurance, and Medicare has done has really quickly evolutionized and revolutionized, I should say, telehealth. We are seeing things happening today that we didn't think was going to happen for another 5 to 7 years, particularly under Medicare. And so it's been interesting to watch the quick evolution of and use of telehealth by providers, not just physical therapists, but other providers. And what will be interesting to see is what happens when this is all over. And, whether it's 3 years or 3 months from now, 6 months from now, a year from now, how are we, making sure that we keep some of these advances that we have made in Medicare and payer policy, again, which is one of the reasons we got to make sure we have a permanent federal fix by ensuring that Congress enacts the Connect for Health Act as part of the COVID Phase 4. Another thing I think that this situation has really shined a spotlight on and the importance of is the PT Compact that allows for interstate practice. For those who are not familiar with it, this is a mechanism that allows for interstate practice for both PTs and PTAs. If you haven't checked it out, go to ptcompact.com and it has a map and information about the compact. It requires a state legislature to pass what's known as the PT Compact legislation, and we've had a number of states successfully pass PT Compact legislation since we started on this endeavor with the Federation of State Boards of Physical Therapy back in 2016. So it has really been interesting to watch how important the compact has been during this situation. I want to also mention that if you do have questions, please be sure to type them in the chat box. And if we missed your question, or if you have something that is a little bit more in depth, you can always email it to advocacy@apta.org.
And I also wanted to just add that going back to what I said about the commercial payers and the payer templates that we'll be making available, we obviously are asking them to extend telehealth coverage for as long as COVID-19 is a public health emergency. But also, we are obviously also advocating that these commercial payers make these policies permanent. And actually, to that point, we had sent a letter back in March to the National Association of Insurance Commissioners asking that they encourage their members, the insurance commissioners, to require the plans regulated in each state to cover telehealth furnished by physical therapists and physical therapist assistants. And because we had submitted that request, they did recently invite us to attend a recent meeting, virtually, obviously, of course, over the phone. And, we took that opportunity to point out that many payers, including commercial payers, are covering telehealth, but that additional work on their part is necessary in terms of ensuring that payers are covering telehealth furnished in institutional settings, including hospitals and skilled nursing facilities and home health agencies, since many insurers' policies only recognize therapist services when delivered by private practitioners billing on the CMS 1500 claim form. So we did make that request. And as I was mentioning, the initial eval issue with Humana Military, we did also encourage National Association of Insurance Commissioners to consider that commercial payer policy should also allow for reimbursement for initial evals done via telehealth when appropriate. And then just, of course, reiterating that physical therapy is and will continue to be a critical aspect of COVID-19 recovery. And of course, as I'm sure you all are familiar, the longer a patient remains in the ICU, the higher the risk for long-term physical and other complications, which is why it is so critical that PTs and PTAs and other rehab providers who are equipped in and experienced in providing the necessary interventions for physical and other impairments can actually provide telehealth, and those services can be reimbursed. So that gives you an idea of kind of the advocacy that's kind of going on behind the scenes, but that can have a significant impact given that we might make a recommendation to the National Association of Insurance Commissioners, and then they distribute that recommendation to all of their members in each state. So the advocacy is never ending, it's ongoing, and we will continue to push for a permanent fix, as Justin talked about, not only for Medicare, but across all payers.
There was this rule that came out yesterday on telehealth from CMS in this interim rule. There were a couple other things in there that were also good and that I think are of interest. One thing I want to touch on is the use of locum tenens by a physical therapist. This was it's policy under Medicare that basically allows a physical therapist to bring in another physical therapist on a temporary basis, whether because they're sick or they need to take time off. Now, back in 2016, APTA advocated and was able to get a bill through Congress that allowed and that added PTs to be able to do locum tenens, just like physicians are able to do. PTs are now able to use locum tenens, but there was a restriction on it, which limited it to just rural and underserved areas. There was also a time limit into how long you can utilize a locum tenens therapist. And Kara, there was an interesting tidbit that was included in yesterday's rule as it relates specifically to locum tenens.
Yeah, so CMS modified the 60-day limit for these locum tenens arrangements. So basically, CMS said that they're modifying the 60-day limit to allow a physician or physical therapist who furnishes outpatient physical therapy services in a health professional shortage area, a medically underserved area, or rural area to use the same substitute for the entire time he or she is unavailable to provide services during the COVID-19 emergency, plus an additional period of no more than 60 continuous days after the public health emergency expires. And then on the 61st day after the public health emergency ends or earlier, the regular physician or physical therapist can use a different substitute or return to work for at least one day in order to reset that 60-day clock. And CMS had said that without this flexibility, the regular physical therapist generally could not use a single substitute to cover sequential 60-day periods. So it is an additional flexibility that CMS recognized was needed during this public health emergency. And so they did issue that additional guidance just within the last week or so.
Kara, we have a question specific on Medicare billing and telehealth. And, is there clear guidance on how to bill Medicare initial evals via telehealth? And, our member says that he's been billing the 1 per week telehealth visit, but they're paying very low. And assuming this means different billing procedures for Medicare?
Yeah, so it's possible. Okay, so Medicare's policy in relation to covering the initial eval, the frequency of the initial eval obviously would be you could furnish the evaluation, you develop the plan of care, and so forth, and it would be just as if you were doing it in person. So you wouldn't be billing an initial eval every week. It would be the one to develop the plan of care, and then you start initiating treatment. Perhaps you're referring to e-visits, which are based on the cumulative time spent during a 7-day period. And e-visits are not telehealth services. They're really meant to be a mechanism to help stay in communication with your patient in between visits. For example, if the patient cannot be seen for a couple of weeks, if the patient initiates an e-visit through an online patient portal, then you would be able to bill for the time spent communicating with that patient and bill it as an e-visit. So keep in mind that Medicare is now covering the CPT codes 97161 through 97163 just the same as they would have been if they were furnished in person. So hopefully that helps to answer your question.
Yeah.
And then I did see, are any states allowing home care telehealth for PT? I do know that Ohio now covers, Ohio Medicaid did recently change their policy, and they are covering telehealth furnished by home health agencies. And that was something that we worked on with the Ohio chapter to get changed. And lo and behold, they did. They expanded the telehealth coverage to include services furnished by home health agencies, which was huge. But I don't know off the top of my head any other states. But do check out our charts that we link to on our apta.org/telehealth page for updates on payer policies related to telehealth.
So, switching gears, I want to just bring up the issue of the E&M codes, which, prior to the pandemic, this was one of our top priorities. And for those not familiar with it, CMS came out last year in 2019 with the proposal to basically revalue the E&M codes, the evaluation and management codes, which are used primarily by primary care physicians. The idea being is to give a boost to payment for primary care physicians. Unfortunately, because the way of what's known as budget neutrality, you can't provide an increase to some folks without making cuts elsewhere. And so as part of their proposal, CMS proposed for implementation on January 1st, 2021, cutting pay to 36 different provider groups, everyone from radiologists and pathologists and orthopedic surgeons, as well as a proposed 8% cut for PT and OT. And so, just thinking ahead we're going through this very difficult time right now. We know that there are facilities and clinics that have closed down or are operating at less capacity. There's a lot of instability right now, not only in the economy, but also within a healthcare system. And it is, kind of scary to think that January 1st, there is the potential that we could see even more cuts to the healthcare system. In this case, on January 1st, 36 different providers, including physical therapists, could see, cuts to their Medicare payment. I do want to let folks know that this continues to be a major push for APTA, working with our allies, working with the OTs and the speech, language and audiologists, dietitians, psychologists, all of the different providers who are slated for cuts. And I think what's interesting is this has definitely caught the attention of Congress and CMS that we don't know what kind of world we're going to be in January 1st in terms of the economy and with healthcare, and the message that implementing deep cuts at a time when we're going to be and hopefully be recovering from this situation is just really bad policy. And so there is a proposal that APTA, along with a number of provider groups, and which more recently the American Medical Association has come out in support of. And that is, we are pushing for language to be included in the next COVID relief package known as COVID Phase 4, that would basically provide what's known as a waiving of budget neutrality. This would mean that Congress would need to put in additional money into the Medicare system. And so that way, those increases for primary care physicians could continue. They could be implemented on January 1. But it would prevent the cuts to the 36 different provider groups. Now, waiving that budget neutrality, that means Congress needs to put money into the system. That's going to cost some money. And so for a full repeal of the cuts, we're looking at about $70 billion. And half of, we're looking at, if we were able just to suspend those cuts for 5 years, about $35 billion. But we are making the case now that this is the policy is, again, we're not opposed to primary care physicians getting increases, but it shouldn't be done on the backs of providers like PTs who don't even bill E&M codes. And so if you have not seen it yet, we do have an action alert on our the federal advocacy page. We will be doing a big grassroots push next week, asking folks to contact their member of Congress with, again, our partners in the coalition. So again, we want Congress to include this proposal to waive budget neutrality on the E&M codes, because that will prevent cuts from going into effect to Medicare on January 1st, which is absolutely the worst thing that could happen for our patients that we serve. And so be on the lookout for that, and just know that that is also an issue we are continuing to work on to prevent that from happening on January 1st.
And I'll also just add that there will be an opportunity to submit comments on the calendar year 2021 physician fee schedule proposed rule, because CMS will be addressing this in some fashion in that rule. And that rule is expected to be released in early to mid-July. There will be a 60-day comment period, and we will have a letter writing campaign for both providers and patients to send letters to CMS addressing and responding to what CMS had proposed. And I'll just do my typical plug that comments really do matter. This is your opportunity to share with the agency, who's required to read the comment letters, all of them. It's your opportunity to share your personal thoughts and opinions as to how such a policy, whether it's an 8% cut or whatever it may be, will impact your ability to deliver care to Medicare beneficiaries, and how that may harm, or if it was a positive proposal, how that may benefit. And so this is, an opportunity to, and I say this for all rules, because the Centers for Medicare and Medicaid Services and all the other federal agencies issued changes to regulations via notice and comment rulemaking and offer comment periods. And oftentimes it's primarily due to the volume of comments, either positive or negative, that influence the agency in decisions. And oftentimes it is due to the individuals who have shared their perspective as to how this policy could play out if implemented in practice. So again, this is something I say all the time, like, please, please, please keep in mind and do not discount how important and how critical your voice is on this and many other policy issues. And we try to make it as easy as possible by providing a template letter with opportunity for you to personalize it. But commenting is a great way to get on the record. You can even do it anonymously, but have your concerns and your comments and feedback formally recorded by the federal government.
Yeah. And the E&M code is a major priority, but we are also advocating for a number of other policy priorities for inclusion in the COVID phase for a package. Along with this waiving of budget neutrality on the E&M codes to prevent Medicare cuts, along with advocating for a permanent fix, policy fix on telehealth. We are also advocating on the issue of hazard pay, asking the government to provide assistance to those providers, including PTs and PTAs, who are on the front lines of this pandemic, and also pushing the federal government to do more as it relates to the distribution and production and distribution of PPP, personal protection equipment, PPE. We know that right now there are a number of providers who don't have access, and we need to see a real focus on making sure that production continues to ramp up and that the distribution is equitable and fair to the providers on the front lines who are dealing with the pandemic. We're also continuing to push for additional assistance to healthcare providers, particularly. While we were glad to see the new program, the Paycheck protection program, and additional money going towards the economic emergency disaster loans through SBA, we along with a number of healthcare provider groups are pushing for funding specifically for healthcare clinics, healthcare small providers, and so there is a policy that we are recommending that would provide grants to healthcare providers, as well as super low interest loans, 0.25% loans for healthcare, specifically for healthcare providers. In addition, we know that what we're seeing with folks who are recovering from COVID, they have a very long, in some cases, a very long road to recovery with muscle weakness and cardiovascular issues. And so we need to make sure that for a long-term policy, that these folks have access to the therapy services that they need. 29 million Americans get their healthcare services at community health centers. And so we have a bill that was introduced prior to the pandemic that would have added physical therapists as primary health services under community health centers. Specifically, it would allow PTs to provide services to Medicare and Medicaid beneficiaries and directly bill for those services. Right now, PTs cannot directly bill for Medicare and Medicaid in community health centers. So we are also saying that in terms of a long-term policy solution, looking out 1 year, 2 years out from this pandemic, looking at the long road to recovery that so many folks are going to have, they need to access therapy services. And one way to address that is to ensure that PTs can do this in community health centers.
Justin, if you don't mind, I do just want to do a quick plug for APTA Engage because it's important to know that APTA nominates members to serve on federal agency committees and task forces and technical expert panels. And we're always looking for experts to nominate to these panels because we know how important it is to have a seat at the table and have the physical therapist voice represented, which often can only be done by a member of the association. So please, if you're ever interested in being nominated or being considered for nomination to any sort of Centers for Medicare and Medicaid Services or National Quality Forum or VA or many other CDC, NIH, if you ever would like to be considered for nomination to any of these panels that they convene, please do go to APTA Engage and check out the national opportunities. And for those that are listed that you're interested in, please do submit your CV with a sentence or two as to why you're interested in being considered for nomination, because these nominations come fast and furious throughout the year. And so we are always submitting a nomination for something. So please do check that out because we would always like to have more expertise to draw upon depending on the nomination opportunity.
Great point. And Carrie, we have one more telehealth question. I know we're coming close to the top of the hour, and it deals with billing, particularly, that the question is, it's their understanding that they cannot perform telehealth with Part B beneficiaries in skilled nursing settings or bill telehealth on the UB04 form. Thoughts on that one? Yeah,
so I'll say that, as I kind of said at the top of the discussion, we are seeking clarification from CMS regarding whether their expanded flexibility to recognize therapists as telehealth providers would extend to therapists who work in institutional-based settings, including hospitals and skilled nursing facilities and home health agencies and rehab agencies even. And so we are waiting to hear back from CMS regarding that. I know that other associations have reached out to CMS as well. So unfortunately, CMS wasn't totally clear in the guidance that they issued yesterday. We do know definitively that PTs in private practice can bill telehealth on the CMS 1500 claim form, but it's less clear in relation to institutional settings. And we have been advocating both on the commercial payer side as well as with Medicare that CMS or whatever the payer include telehealth coverage for services furnished by therapists in institutional-based settings. And so we thought that CMS would definitively recognize institutional settings as eligible to furnish and bill for telehealth. It doesn't seem totally clear that they didn't or did. So we are seeking guidance. So at this point in time, all I can say is we're seeking clarification as to whether telehealth furnished by therapists can be billed on the UB04 claim form in the institutional setting. And I do know that there's been a lot of questions related to hospital outpatient departments. And again, the guidance that CMS issued was actually even less clear in relation to hospitals. So we have reached out to CMS already to ask that they clarify immediately the capability of therapists being able to furnish and having the hospitals bill for those services telehealth services via the UB04.
So, just looking ahead, it's May 1st, and what does the next couple months have in store in terms of advocacy, both regulatory and on Capitol Hill? We anticipate that Congress is going to come back in about 2 weeks to try to start ramping up their work again. First on their docket will be the COVID Phase 4 relief package, and we're watching very closely as to what that timeline could be. Will it be passed by Memorial Day, or will it get pushed into early June? So we're watching to see how the politics of this are going to play out. But we are hopeful that Congress will act quickly on that legislation and include a number of our policy priorities, including the E&M code issue and a permanent fix to telehealth. But Kara, we are about to begin the busy season in terms of regulatory rules and proposed rules. And so what are some of the rules that we anticipate coming out in the next couple of weeks?
So, as you may have already seen, we saw CMS release the fiscal year 2021 skilled nursing facility payment rule, as well as the fiscal year 2021 IRF payment rule. Neither rule has very many changes, but we did develop a template letter for individuals who would like to submit comments to CMS regarding the skilled nursing facility proposed rule, given all of the concerns and feedback that we've been sharing with the Centers for Medicare and Medicaid Services related to the patient-driven payment model. So as I was saying earlier, this is an opportunity to share feedback with the agency using the template letter that we've provided, and we can link to the regulatory take action webpage in the comment chat box in a moment. But so we've seen those rules come out, and then we will be seeing the acute care hospital inpatient payment rule be released. And then shortly thereafter, we'll see the DME rule. We'll see the home health rule for 2021, which may or may not include any sort of changes to the patient-driven groupings model. Likely not, due to it was just implemented in January, and they haven't been able to collect a lot of data yet, and particularly the fact that the data being collected right now during COVID is going to skew, the overall numbers given the changes needed in relation to care delivery. But then we also have the physician fee schedule proposed rule coming out in July. So we'll probably see the home health rule, physician fee schedule rule, durable medical equipment, and hospital outpatient prospective payment system rules all come out around early to mid-July. And all of these rules have 60-day comment periods, and we will be submitting comments on all of them, in addition to providing template letters for those rules that we would encourage individuals to submit comments on as well.
Yeah, and from a congressional standpoint, once Congress gets, hopefully gets the COVID Phase 4 package done, then they're going to hit summer recess and then the election. And so really this COVID Phase 4 package is going to be probably the last major piece of legislation we see implemented by Congress until after the November election. Because they will be going home for the summer break, the fall campaigns. And so after the election, they will need to come back and do some last end of the year budget issues, reauthorization of a number of programs that will be expiring. And so we anticipate not a whole lot coming out of Congress after this COVID Phase 4. But, just a reminder to make sure that, a great way to advocate not only with writing to your member of Congress or participating in the federal advocacy forums or on social media is to get involved in a campaign and to know who your member of Congress is, because we have a lot of issues that we are managing right now, and the election is obviously going to be one where these other issues are going to be discussed, and so please be sure to stay active. Kara, we have a lot of resources as we begin to finish up. We have a lot of resources on our website that we are updating every day. So, for example, apta.org/telehealth, apta.org/coronavirus, and apta.org/federal advocacy. Am I missing any?
We included the link to the regulatory issues take action. That's where you can find the template letters to submit comments on proposed rules and policies. What else? You should always, I should say, if you don't already receive APTA's news blasts on Wednesday and Friday of every week, please go to your membership profile and opt in, because that's a summary of all of the articles that we've published, webinars, over the last week or over the last couple of weeks. And I know that we've been putting out so much information. It's a good way to catch up if you've missed some of the daily articles being posted on social media or on the homepage. So we do have those Wednesday and Friday news blasts. So otherwise, you can always check the APTA.org homepage, but it won't necessarily list out every single PT in Motion news article or story that we might have published recently.
And if you want to receive action alerts, what's going on Capitol Hill and regulatory agencies, be sure to subscribe to APTA's P-Team newsletter. Go to apta.org/P-Team and subscribe to that newsletter. And also, if you haven't done so, be sure to download the APTA Action app on your phone. It's available for Apple and Android, and it's a great way to receive alerts. You know, as Kara mentioned, we have a lot going on just in the next few months. We will be doing a major grassroots push next week on the E&M codes, but we have a lot of proposed rules that will be coming out, and we're going to continue to fight on issues like telehealth, hazard pay, personal protection equipment, and more. So we have a lot going on during some very interesting times and difficult times, and so really do appreciate everything that everyone is doing. I don't think we have any more questions. Let me see. I think we're about done with questions.
I'll just reiterate again that we are seeking clarification related to telehealth in the hospital outpatient setting because the interim final rule issued by CMS and the accompanying guidance has led to some confusion, and it's unclear as to whether physical therapists in hospital outpatient departments would be able to furnish telehealth and have the hospital bill it on the UB04. So please stay tuned. As soon as we have additional information from CMS, we will be sharing that widely.
All right. Well, I think we are at the top of the hour. And so again, want to say thank you to everyone who took time out of their day to watch this broadcast. And again, really appreciate the work that everyone is doing during these difficult times. I know that these are stressful times. There's a lot of uncertainty. But again, you know, as Kara mentioned, we're trying to put out a lot of information and resources to help you and your patients to get through this. And so want to say thank you for doing what you do every day. Thank you for your advocacy. And most importantly, thank you for being members of APTA.